Assalamu alaikum warahmatullah. Our topic today about malaria. Malaria is a tropical disease caused by four plasmodia, either Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, Plasmodium falciparum. The vector and definitive host for Plasmodia is the female Anopheles mosquito. There are two phases in the life cycle of this parasite: sexual cycle and asexual cycle. Sexual cycle, which occur primarily in mosquito, and asexual cycle, which occur in humans, the intermediate host. The sexual cycle is called sporogony because sporozoites are produced. The asexual cycle is called schizogony because schizonts are made in this cycle, okay? Humans are infected through the bite of infected female Anopheles mosquito, just female Anopheles. Male Anopheles not carry the parasite and not infect the human being, okay? Infected female Anopheles mosquito that inoculate spindle-shaped sporozoites into the blood stream. The incubation period is about 2 weeks, but this may be prolonged. This diagram explains the life cycle of the parasite inside the mosquito and in the blood. The sporozoites of all Plasmodium species reach the liver in the bloodstream and infect the hepatocytes, in which asexual multiplication takes place. In this process, the sporozoid develops into a multinuclear large schizont described as tissue schizont because inside the liver. Following cytoplasmic division of schizont, merozoites are produced. Shortly thereafter, the tissue schizont release the merozoites, which then infect the erythrocytes in the blood. In infections with Plasmodium vivax and Plasmodium ovale, the sporozoites develop into tissue schizont, but some remain dormant, so-called hypnozoites. This occurs just in Plasmodium vivax and Plasmodium ovale, the stage of hypnozoites, which may develop into schizont following activation after months or even years. The merozoites produced in the liver are released into the bloodstream, where they infect the erythrocytes, in which they reproduce asexually. The merozoites attach to the receptor molecule on the erythrocyte surface. These receptors are species-specific, which explain why certain Plasmodium species prefer certain cell types. For example, Plasmodium malariae infect mainly older erythrocytes, and Plasmodium vivax and ovale prefer reticulocytes, which is the early stage of the erythrocytes, and Plasmodium falciparum infects younger and old erythrocytes. That explains why the clinical feature of Plasmodium falciparum will be more severe than other species of the Plasmodium, because it can infect all the types or all stages of the erythrocytes. Okay, the ring forms called merozoites develop into schizont, which feed on glucose and hemoglobin. Once they feed on hemoglobin, that means this patient can be presented with anemia, can be presented by low blood glucose. The schizont undergoes multiple division to produce merozoites in different number depending on the Plasmodium species. The merozoites enter the blood plasma. When the erythrocyte is destroyed, they infect other erythrocytes and begin a new asexual cycle. A cycle takes between 48 hours with Plasmodium vivax and Plasmodium ovale and Plasmodium falciparum, and 72 hours with Plasmodium malariae. Fever is induced when the schizont bursts and when many red blood cells fight at once, causing the typical intermittent fever attack. The fever attack in the patient with malaria has attacks. The schizont rupture and produce the These merozoites, okay, can lead to a fever. After one or more schizogenic generation, some of the plasmodium develop into sexual forms. The male microgametes called microgametocytes and female macrogametes اللي هي macrogametocytes. These sexual forms, gametocytes, persist for a certain period in the blood in Plasmodium vivax 1 day, Plasmodium falciparum up to 22 days, after which those not taken up by blood-sucking Anopheles females will die. Pathogenesis. Most of the pathologic findings of malaria result from the destruction of the red cells. Red cells are destroyed by the release of merozoites, the RBCs ruptured, the action of the spleen sequester disinfected red cells are lysis in the spleen. Disease caused by Plasmodium malariae is called quartan malaria because it recurs every fourth day. The fever recurs every fourth day. Malaria caused by the others is called tertian malaria because it recurs every third day. Tertian malaria is subdivided into malignant malaria caused by Plasmodium falciparum and benign malaria produced by Vivax and Plasmodium ovale. Why we said malignant? We said it has more severe clinical feature because it infects all the red blood cells, the old one and young one, but Plasmodium vivax and Plasmodium ovale, one infect the old RBCs and one infect the young RBCs. Plasmodium falciparum causes high level of parasitemia because it can infect red cells of all ages. In contrast, Plasmodium vivax infect only reticulocyte and Plasmodium malariae infect only mature red blood cells. This diagram explains sequelae of infection with Plasmodium falciparum causing malaria. Look at this diagram. Parasitized red cells activate the immune system. This will activate tumor necrosis factor production and this can lead to shock or even pulmonary edema. Also, activation of the immune system can lead to tropical splenomegaly because sequestration of the infected RBCs. Tropical splenomegaly can rupture or even this tropical splenomegaly will sequester the RBCs and lead to the anemia. Okay. Also, parasitized red cells can go to the placenta and affect fetal, can lead to fetal malnutrition. Also, these parasitized red cells can be sequestration in deep vessels and lead to obstruction of microcirculation. This microcirculation in the spleen or in the brain, for example, in the splanchnic area, can lead to acidosis, can lead to there is decrease in gluconeogenesis. That means this can lead to hypoglycemia. Also, splanchnic can lead to gut blood flow decrease. This will lead to endotoxic shock. And obstruction also of microcirculation can affect the brain, lead to coma and death. That's why we said about Plasmodium falciparum is the malignant malaria. All these can occur in Plasmodium falciparum if untreated. Clinical finding: fever followed by sweats and chills, headache, myalgia, arthralgia, and nausea. Vomiting, abdominal pain, splenomegaly is seen in most patients. Hepatomegaly, anemia. Patient usually feel well between the febrile episodes. Between the febrile episodes, the patient usually feel well. Untreated malaria caused by Plasmodium falciparum is life-threatening as a result of either cerebral malaria, we said can lead to shock, can lead to hypoglycemia, can lead to coma. Because of black water fever, what is black water fever? Can lead to even hematuria, can affect renal, can affect the kidney. Malaria caused by other three plasmodiums usually self-limit with a low mortality rate, but the more risk malaria and fatal untreated malaria is Plasmodium falciparum. Okay, this diagram explain pathogenesis of sequestration in falciparum malaria. These in the above parasitized RBCs. Okay, parasitized RBCs inside it ring trophozoite. This can attach to the can attach to the endothelial cells of the blood vessels, lead to stasis of the micro circulation, and lead to sequestration within the blood vessels. Diagnosis: microscopic examination of the blood using both thick and thin James stained smear. This the type of the smear of the stain used to examine the plasmodium under the microscope. The thick smear is used to screen for the presence of organism. The thick smear just malaria is positive or negative. We don't know the type of the species of the plasmodium in this type of the smear. And the thin smear is used for species identification. It is important to identify the species because the treatment of different species can differ. Ring-shaped trophozoite. Ring-shaped trophozoites can be seen within infected red blood cells under the microscope by thin James stain smear. Look at this picture. This Plasmodium falciparum ring-shaped trophozoite inside the RBCs. We see this shape under the microscope. The gametocytes of Plasmodium falciparum are crescent-shaped or banana-shaped, while those of other Plasmodium are spherical. If blood smear do not reveal the diagnosis and the symptoms, for example, is malaria, then we can do PCR-based test for Plasmodium nucleic acid or an ELISA test for a protein specific for Plasmodium falciparum can be useful. Also, we can do ICT, which depend on antigen of the Plasmodium or antibody against to this Plasmodium. Treatment according to the type of the species, we have a specific treatment for each species. Nowadays, there is intravenous artesunate. There is some new types of tabs, and that is. And good luck.